Modern medical diagnosis has entered the high-tech age. With the introduction of the CT scanner and MRI, cancer tissue of only a few millimeters in diameter can be detected in its early stages. However, these high-tech medical tests are not only expensive, escalating the cost of medical care, they are sometimes harmful or painful to the patient. But there is a new, more simple, non-invasive, safe, reliable and very economical method of diagnosis available. It's called the Bidigital O-ring test and can provide much useful diagnostic information.
Well, I cough a lot.
You cough, Hey.
My chest gets tight. And I hear a high-pitched sound in the back of my head.
Please move back about 20 centimeters. First, I'll check your bronchial tube. There's nothing wrong there. Now the right lung. You have very strong abnormality here. Now the left lung. You have no problem with your left lung. This is the bidigital O-ring test, which allows abnormalities in the body to be found by seeing if the ring made with 2 fingers can be pulled open or not, and by noticing the degree of opening. Since the discovery in 1977 of the bidigital O-ring test by Professor Omura, much research has been done and considerable information behind the mechanism of the test is now known. If this method becomes established, not only can the diagnosis of difficult medical problems be made, but also optimal treatment including effective medication and dosage can be determined. In Japan, many physicians and dentists are already being trained in this method. In 1990, the Japan Bidigital O-ring Test Medical Society was established. This group holds annual symposiums at Tokyo University. In addition, they hold an international symposium every 2 years.
Hello, I'm Yusuke Kawazu.
Hello, I'm Tamako Nakano.
When we talk about medical diagnosis to examine inside the body, we tend to imagine CT and PET scans, MRI, ultrasonic diagnosis, and other complex examination methods. But if a diagnosis could be made with just 2 fingers, it would be quite revolutionary.
The O-ring is simply made with just 2 fingers. I have doubted it myself. Can they really make a diagnosis like that? According to clinical examples, there are a considerable number of reports that show significant results.
Television Museum has been researching this phenomenon called the bidigital O-ring test recently. Also, I learned that many doctors are seriously trying to learn, understand and practice this method, incorporating it with Western and Asian medicine. For 2 weeks, we are going to investigate the bidigital O-ring test.
By seeing if the O-ring made by 2 fingers opens or not, any abnormality in the internal organs can be detected without the use of high-tech machinery. This method was developed by Professor Yoshiaki Omura, a Japanese-American physician trained at Columbia University Medical Center and Director of Medical Research at the Heart Disease Research Foundation in New York City. It has begun to receive attention in many parts of the world. In Finland, the Ukraine, Yugoslavia and Venezuela, the bidigital O-ring test has been incorporated into the medical school curriculum. In Japan, more than 10,000 physicians, dentists and acupuncturists participated in Professor Omura's seminars. And as a result, many doctors in different hospitals have begun to compare the results of the O-ring test with standard laboratory tests. St. Mary's Hospital of Kurume City, the second largest and model hospital in Japan, is one of many research sites to compare the O-ring test with lab tests.
This is Dr. Shimotsura, Director of Medicine at St. Mary's Hospital, who was conducting the examination earlier. Thank you for your time. Could you please show us how to do the O-ring test?
Please turn and face me. Please make a ring. Let's start with the right hand. It's best to make the ring as round as possible. The examiner also makes 2 similar rings and pulls at the ring that you have made. Let's try it.
Is it better not to open?
Yes. This is before we begin testing. So, we use this to select the test finger. Next, the thumb and the third finger. This also won't open. The thumb and the fourth finger. This opens easily. The thumb and the little finger. This also opens easily. If we use the fingers that were easily opened in the examination, no matter where we examine, the result will always be the same. So, we use the test fingers that can resist the examiner's pull.
So you choose the person's stronger fingers over the weaker ones.
That's right.
How do you use this to diagnose an illness?
Well, as we just showed, we choose which fingers to use by trying to pull them open. Then, we confirm that they won't open by touching a normal part of your body.
For example, the head.
Yes, we will examine the head.
Is that bamboo?
Yes, it is. We use a non-conducting rod in this direct method. They won't open.
So there's nothing wrong with my head.
Yes, that's right. Now the bronchial tube.
They won't open?
No, they won't open.
So there's nothing wrong there either.
That's right. Now let's try the heart.
I wonder what that's like.
What?
They open.
They opened, didn't they? So there is something wrong with my heart.
That's a possibility.
There is quite a difference between when they open and when they don't.
There is a difference, even though I'm applying the same pressure all the time.
Yes, there is.
Even though he's wearing clothes, the results are still very clear.
Therefore, in the control, we choose the fingers to use or the results will differ. In actual clinical examinations, often a third person makes the O-ring, not the patient themselves. So does this give the same results?
Earlier, you were using the assistant's O-ring to make the diagnoses. How does this work?
In a one-on-one situation with the patient, we conduct the examination using a non-conducting rod touching various parts of the body. However, we can also use a third person. This is known as the indirect method. Let's try it now.
Okay.
Please sit down.
So you'll examine the same places you did before?
That's right. The abnormal electrical signals from the patient will be transmitted through the conductor to the third person's body. Using the third person's central nervous system, we can make an analysis. First,
The head of the patient.
So that means the head is all right.
right, the bronchial tubes. There's nothing abnormal there.
The same results.
That's right, the same results.
You get the same results, even if you use a third person. So, do you also use a non-conducting rod if you use a third person?
No, we use an electroconductive rod. Either a brass or copper rod is used during the examination. If the patient or a third person holds a pathological sample such as cancer tissue, the O-ring will open, if the patient has the same cancer tissue. Let's use the O-ring test to see if Yusuke has cancer or precancer of his stomach. Dr. Shimotsuura is holding prepared specimens of stomach cancer tissue on a slide. He will place these on Yusuke and conduct the test. If Yusuke has stomach cancer, the O-ring will open. If he does not, the O-ring will not open. Let's do the test. The O-ring will not open at all, which shows that Yusuke does not have stomach cancer. Let's explain this again in plain English. There is a patient with an illness in his or her internal organs. First, we place a microscope slide containing liver cancer tissue on the patient's arm or palm and conduct the O-ring test. If the O-ring test does not open, the patient does not have liver cancer. Next, we do the same with stomach cancer tissue. If the O-ring opens, the patient is diagnosed as having a high probability of stomach cancer or pre-cancer. With prepared specimens of various pathogenic bacteria or monoclonal antibodies of various viruses, tests can be conducted on the patient and the type of causative pathogenic microorganism can be identified. Dr. Omura discovered that by holding a prepared specimen of a type of normal body tissue, the outline of the internal organs can be mapped out on the body surface by using the bidigital O-ring test. Let's map out Yusuke's stomach. Of course, the assistant is holding a prepared glass microscope slide containing a specimen of normal stomach tissue. Moving the metal electrode a little at a time, a mark is made on each spot where the O-ring opens markedly, but does not open when moved even a millimeter outward. Within 15 minutes, Yusuke's stomach has been mapped out. This is a patient's stomach that was mapped out using the O-ring test. A piece of copper wire is placed along the outline of the mapped stomach. This is the X-ray of that patient's stomach as we just saw it. It's hard to see if you're not a specialist, but apparently the metal wire is in just about the same position as the stomach shown on the X-ray film. What you have just seen demonstrate was the application of resonance phenomena between two identical substances to map internal organs without using high-tech equipment. A few days ago, this patient complained of back and stomach aches. An X-ray was taken and it was found that there were stones in the kidney and in the ureter. Here, an examination is being carried out to monitor the progress of the illness. Using the O-ring test, the kidney and the ureter are being mapped out on the patient's body surface. The two large blue spots mark the current location of the kidney stones. Do you see the narrow section towards the bottom? There's a mark there.
That's where the stone is?
Yes, the stone is stuck there.
It can't move?
Because it can't move any further, its upper part has become enlarged. There is one here in the middle of the kidney. And another is here in the ureter. Because it is stuck, the upper part of the ureter has become enlarged, and the inflammation can be seen in the kidney as well. This area here.
You mean the folds?
This is the kidney. And as you can see, compared to the other side, this kidney is enlarged. Also, since this was taken when the pain began, there are two stones, here and here.
These are the stones, aren't they?
Yes. They've probably moved down further to here by now.
Ah, because they are stuck here, the ureter has enlarged.
Yes, that's right. With the O-ring test, when the ring opens, there is very little strength in the muscles. Do the muscles really lose their strength?
This patient has agreed to help with this experiment to see whether muscle strength actually drops.
What is the apparatus we will be using?
As you've just seen, we read the change in strength in the fingers as the computerized pulling mechanism decreases the pressure it puts on the O-ring. The computer monitors the change. 1, 2, 3. First, the strength in the assistant's fingers is measured in a normal situation. There will be slight differences, so it is repeated 5 times. This time it was 6.6 kilograms. 1, 2, 3. 7 kilograms.
It's basically around the 6.5 to 7 kilogram range.
That's right. This is a graph showing the results of the 5 trials.
This time, you will carry out the same experiment using a prepared specimen.
Yes, that's right. This is a prepared specimen of ulcerative colitis tissue. This patient has been hospitalized for ulcerative colitis. The assistant holds the prepared specimen and please take the electroconductive rod. If the prepared specimen and the patient's illness match, muscle strength will drop. 1, 2, 3. Again, this is done 5 times. What are the results? The red lines are the results when the prepared specimen was held. Compared to the white lines, the control, it can be seen that muscle strength decreased. Now we will do the experiment again, this time with the patient. First, the control. Next, with the patient pointing to his colon with a bamboo rod. The results, as can be seen, show that even though there are slight variations, there was a clear drop in muscle strength.
We just use the device to find out whether muscle strength actually drops. It clearly showed that it is not a mere coincidence.
They naturally open, don't they?
So with the results of the bidigital O-ring test and the results of tests using current technology, there is a good correlation between the two.
But to what degree is O-ring test reliable in the diagnosis of illnesses?
Although the concept and procedure are simple, the results are remarkably accurate, consistent, and can be obtained quickly.
So what we're going to do is, first have Yusuke and another patient undergo the bidigital O-ring test, then have tests using current diagnostic methods. After that, we will compare the results of both sets of tests and see how accurate they are.
This patient, a 76-year-old female, came to hospital complaining of a lack of appetite and fatigue. The O-ring test showed that there is an abnormality in her stomach. First, her stomach is mapped out. Then, further O-ring tests will determine the kind of illness and its location. If the O-ring opens when using aluminium foil as a wide area electrode, the problem is somewhere under the area covered by the foil. The piece of foil is folded smaller to try and pinpoint the location. Once found, testing continues to pinpoint the exact location of the abnormality. As yet, nothing in this area has been found. It looks like the abnormality has been located. Once again, the area around this spot is checked to confirm that nothing has been overlooked. I think this here is the abnormal spot.
What can you tell from the results of this patient?
By holding the prepared specimen of stomach cancer tissue, we looked for the spot that would react to it using aluminium foil. Since there was only one spot about the size of the point of the rod within the reaction area, I seem to think that the abnormality is quite small.
Do you mean a small area of cancer?
It did react to the cancer tissue, but because it is quite small, I'm not sure whether it is cancer or precancer.
So it may be difficult to detect using the current technology.
Yep. Please open your mouth wide. Then, a test is done using the endoscope to see whether it is cancer or not. I'm about to put it in. Please relax your stomach. That which can be seen in the background is the duodenum. They found the abnormal spot, but are not sure yet whether it is cancer or not. Here, they apply a saline solution of indigo carmine. Cancer tissue has a tendency to repel a dye solution. It is unmistakably cancer. If we didn't apply the solution, we wouldn't have recognized it as cancer. This end of the piece of wire is 5 millimeters in length, and we'll insert it in until it gets to this spot. Next, they measure the size of the cancer. When we placed it near the cancer, we found the red area. You can see it is less than 5 millimeters in diameter. Just as the O-ring test showed, they found stomach cancer. Let's hear more about the area where they found the cancer. This is an image showing the whole stomach. The illness is in the area which is surrounded by the black dots. This is the cancer just above the center. In this case, if we compare the two tests, the locations are roughly the same. Incidentally, even though the cancer is so small, apparently can be detected with very high accuracy. Looking at the position of it, I tend to think that it's in an area in or around the heart. Next, the O-ring test will be conducted on Yusuke, the results of which will be compared with those of tests done later using conventional methods.
You are outlining the weak area with the marker.
That's right. According to the results of the O-ring test, the area that has been outlined from the heart around to the back is not normal. The next area that showed some abnormality was the area around the neck. The test is carefully conducted using various prepared specimens. The results of the examination. The diagnosis shows that Yusuke's problem seems to be in the cervical vertebrae found in the neck.
The areas shaded in pink, these three areas, are the ones that showed the strongest reaction.
That's right. Muscle strength was at a low in these areas, and I think there is a strong chance that the abnormality is here. After this, using the latest in medical technology, the areas showing some abnormality will be re-examined. First, let's look at what the results were from Yusuke's O-ring test last week. There is no communication between the doctor and the patient. The doctor has begun looking thoroughly around the neck. The abnormality seems to be especially strong around the cervical vertebrae. The results seem to point to a mild disc herniation in the vertebrae. So I started to wonder if they may be the symptoms of pressure from a herniated disc. I'd like to take further tests.
Here we go.
Will they really find anything in or around the cervical vertebrae? This time, tests will be done using high-tech methods. We actually took an X-ray before doing the MRI. Let's take a look. If you look here, this is the second vertebrae. 2, 3, 4, 5, 6. The seventh vertebrae. The sixth and seventh. 3, 4, 5. There's an abnormally strong curved bone formation in front of the fifth, sixth, and seventh vertebrae.
Do you mean the pointed part? That's not normal, is it?
Not necessarily. It occurs with age, but it's quite severe for someone 56 years of age.
Really?
Normally, it looks like this, a squarish shape. However, there looks to be a little pressure on the vertebrae. You can tell from this part that it is sticking out and looks like a bird's beak.
What can you tell by looking at an MRI?
Well, here you can only see the bones. The white parts you see are the tissue beneath the skin, but you can't see the spinal cord in this X-ray. The MRI will show the condition of the spinal cord, that is, the inside of the spinal tract. We can see if there is a displaced disc and if it is putting any pressure on the spinal cord.
Uh-huh.
We can see what state the spinal cord, not only the spinal cord, but the head or any other part of the body is in by taking an MRI.
Which part are we looking at?
This part here. This is the second vertebrae. The third, fourth, fifth, sixth, seventh. These are the three, the ones we were talking about earlier. The fifth, sixth, seventh cervical vertebrae. These are thoracic vertebrae from here down. Between the fifth, sixth and seventh are the slightly herniated discs. These white parts here. They're sticking out at the back. Here.
Oh, I see them.
This is the spinal cord. This is the spinal tract. The spinal cord runs through here. It's not very wide to start with, so if they stick out a fraction, it becomes even tighter. So, the symptoms will appear even if they stick out only slightly. Both the results of the O-ring test and the traditional modern diagnostic test done showed Yusuke's problem to be in exactly the same place.
The O-ring test results and the results of the other tests matched perfectly, didn't they?
That's right.
So, can it be said that it is also effective in medical examinations?
Yes, it can. It is very effective in diagnosing the location of bacterial and viral infections that may or may not show up in blood tests, X-rays or MRI. An important application of the bidigital O-ring test is screening for cancer in its early stages. Since it is a test using human fingers, it looks subjective and unreliable, but the opening of the ring is quantifiable and a reliable indicator, so long as Dr. Omura's procedure for selecting the test finger is followed.
So, by screening for cancer, you mean that it can be used to see whether a patient is in the high-risk cancer group or not?
That's right.
Have you done any work in this area?
Yes, I have. Up until now, I have actively followed up on any patients who have showed strong resonance with microscopic slides containing adenocarcinoma tissue of the stomach.
Using X-rays?
Yes, I do further tests. At the same time, I also do further checks on the patients who didn't react to the O-ring test. Let's have a look at the results of medical examinations Dr. Shimotsura has done for stomach cancer. These are the results of examinations done using the O-ring test on 380 patients who came to the hospital with a variety of symptoms for checkups. The number of patients that reacted with an open O-ring to stomach cancer tissue was 69. Of those, 9 were found to have cancer when an endoscopic examination, X-rays and biopsies were done. 311 patients did not react to stomach cancer. Of those, not one was found to have stomach cancer when the same laboratory diagnostic tests were performed. According to statistics, the stomach cancer detection rate by annual screening averages about 0.1% in Japan and 0.05% in the rest of the world. But Dr. Shimotsura's rate was more than 20 times higher. No doubt there is something to this phenomenon, the O-ring test. How can such a method of diagnosis be possible? First, in the case that there is an abnormality in the person's body, why is it that muscle strength in the fingers declines when the skin above the pathological area is touched? We visited Showa University in Tokyo. Making the O-ring with the fingers is a voluntary movement. A command comes down from the cerebral cortex to the fingers to form a strong O-ring that can resist being pulled open. Then, the electrode held in the other hand is directed toward the body surface, above a pathological area. This produces a message from the skin surface, above the pathological organ, to the central nervous system, which interferes with the original message to the fingers, to keep the ring closed. The fingers open because the voluntary movement command has been intercepted along the way.
In the case that there is no abnormality in the stomach, the fingers don't open. How does that work?
Because there is no abnormality in the stomach, this information is not relayed to the central nervous system, and hence there is no change in the skin. Since there is no change, even if it is touched, there is no impulse to intercept the command to form and maintain the ring.
So does this flow not exist in a normal situation?
According to whether the fingers open or not, we can tell if this abnormality exists. In the case that there is an abnormality in the body, if the skin near it is touched, there is a loss of muscle strength in the extremities. This has in fact been confirmed in animal experiments by Professor Takeshige, Dean of the Medical School of Showa University. A rabbit with a duodenal ulcer is made to move his paw by electrical stimulation of the motor cortex of the brain. Next, an electromyogram EMG is used to see whether there is a drop in muscle strength in the paw when the skin near the duodenal ulcer is pinched. These are the results. The white areas are formed by the disappearance of the EMG action potential that occurred when the skin above the pathological area was pinched. This shows that there was a drop in the rabbit's muscle strength in the paw. First, I'll check the bronchial tube. There's nothing wrong there. Now the right lung. There's an abnormality there. Now the left lung. You have no problem with your left lung. In the use of the O-ring test, even very slight stimulation of the skin above the pathological area will cause a drop in muscle strength in the fingers. It has been reported that the test will not be reliable if there are objects that emit electromagnetic waves such as electrical appliances nearby. Electrical or magnetic fields also interfere. We will do a test to see if the results of the O-ring test are thrown off by a battery and a magnet. We will try it on the neck where we already know there is an abnormality. There is an abnormality of about -4 here. Now pick up the battery. Hold it by the negative pole.
Is this okay?
Yes.
I'm holding the negative pole.
The abnormal response has disappeared.
The O-ring test cannot sense any abnormalities in my neck.
That's right.
I'm only holding a little thing like this.
Okay, now hold the telephone card with the magnetic strip.
I'm now putting the telephone card in my hand.
In the same way, the O-ring test does not work.
Then it can be said that the results of the O-ring test can be influenced by magnetic objects such as these.
That's right. There seems to be a strong relationship between the O-ring test and electromagnetic waves. What does Dr. Omura, the originator of the O-ring test, think? Each part of the body has electromagnetic waves like this. Dr. Omura says that normal tissue and abnormal tissue each have their own electromagnetic waves and emit electromagnetic waves of different frequencies. When the skin near the abnormal area is stimulated, the information from the abnormal area is electronically sent through the nerves to the part of the brain called the pons, where it is relayed to the nucleus reticularis gigantocellaris, which is located on both sides of the nucleus raphe magnus that exists in the center of the lower part of the pons, which sends negative feedback to the alpha motor neurons and relaxes the muscles. Electromagnetic resonance between two identical tissues can also relax muscles. Let's give an example. This is a prepared specimen of stomach cancer tissue on a slide. This is placed on Yusuke's arm. If Yusuke has stomach cancer or a precancerous condition, the O-ring will open. If he does not, it will not open. Let's try it. The O-ring will not open, so it shows that Yusuke does not have stomach cancer. Why does this happen?
The O-ring will open if the patient has the same pathology in his body as that in a pathological specimen on a slide he is holding in his hand. How does this work?
This is quite complicated. The matter inside the stomach emits electromagnetic waves. If they are similar to the electromagnetic waves emitted by similar specimen tissue, that would be picked up by something like a resonance receptor, if such a thing existed. That sensor would work to restrain the muscles in the fingers, and hence voluntary movement would also be restricted. Very little is known about this sensor, if it exists. That is how it could work. However, the actual mechanism is not yet completely understood.
So, it would be explainable if there were a sensor able to detect the electromagnetic waves from within our bodies and compare them with the resonating waves from identical substances outside of the body.
That's right. Put simply, it depends on whether the electromagnetic waves the stomach cancer tissue in the body emits and the ones the prepared specimen emits are the same. There is something like a resonance sensor in the human body which senses the identical frequencies. Is it possible that human beings can feel these electromagnetic waves subconsciously? We were shown an interesting experiment by Professor Tani at Meikei University.
You have attached electrodes to the subject to read the brainwaves. What sort of experiment are you conducting?
It is an experiment to see whether the human body has the capacity to work as a sensor for electromagnetic waves.
How will the experiment be conducted?
I will shine a light of about 80 luxes on the thumb, then see if the brain senses it or not.
Are you going to see whether the skin on the hand can sense weak light that the subject doesn't feel by detecting changes in the electroencephalogram?
Yes, that's right.
What are you doing now?
I'm looking for a stimulus point.
A stimulus point?
A point to shine the light on?
Our bodies have different resistances to electrical currents. There are parts difficult for the current to flow through and others where it flows through easily. The part of the thumb where the electrical current flows easily is found, and that is where a weak light will be shone. First, the brainwaves are measured when the light is off. The subject has her eyes closed, so she does not know when it is switched on. Here, we shine 80 luxes of light on the thumb. Humans cannot feel any sensation, including heat, from this amount of light. This experiment is done on 10 people, and the changes in their brainwaves when the light is on and off are recorded. The data is recorded on this machinery. The collected data is analyzed by computer. The changes in voltage of each brainwave, such as the alpha wave or the beta wave, are read. The brainwaves change according to the zone in the brain that is active, but they can roughly be grouped into 4 classifications. When we are moving around actively, beta waves are emitted. This is a graph showing the brain waves emitted from the front of the right side of the brain. The blue bars show no light stimulation and the pink show the amplitude of the EEG components during the weak light stimulation. If you compare the pink bars to the blue, it is clear that the voltage output of the brain waves increases during light stimulation of the hand. These are the results from the front of the left side of the brain. As can be seen, the voltage output increased here as well.
There was a difference in the voltage output when the light was shone and when it was off. What does that show?
I think, basically, that the body is reacting to the stimulation.
The subject didn't notice it, but the human body can sense weak light like that.
That's right.
Even though light was shone on the finger, the subject didn't consciously think, "Oh, there's light shining on my finger." But that part of the thumb immediately senses it and sends that signal to the brain.
Yes, that's right.
Then we can conclude that there are light sensors in the body besides those in the eyes.
Since the light beam is electromagnetic waves, the human body has sensors for these waves besides our eyes. There are still a lot of things we do not understand about our bodies, but the O-ring test is an important tool which helps us understand the role of electromagnetic waves in our bodies. Apart from being used as a method of diagnosis, the O-ring test can be used to tell which medicines would be effective in treating diseases and what the optimal dosage for each individual patient is. This person has chronic tympanitis, inflammation of the middle ear. I can say that the ear and also the area around the ear is impaired. The O-ring opens. This time we put this medicine in the patient's hand while she points to the infected ear. The O-ring is strengthened and no longer opens. That is to say, effective medicines increase the strength of the fingers forming the O-ring, overcoming the weakening influence of the pathological area. If we check other medicines, we can decide which medicine is the most suitable for this patient by noticing the relative strengthening of the weakest finger. Now this. The O-ring weakening reaction completely disappears the moment I put the effective antibiotic in the patient's hand, while the rod is contacting her pathological area.
Do you think the O-ring test has credibility?
Yes, taking into account my experiences of the last 10 years, I think that it's gained considerable credibility. At first, I couldn't believe it myself, but since I started using the bidigital O-ring test, the therapeutic results for my patients have become better by far, and I have learned a lot more. As a new method of diagnosis for the 21st century, the bidigital O-ring test is attracting much attention in many parts of the world. Other than being used as a method of diagnosis and in the selection of effective medicines, the O-ring test is also showing unexpectedly promising results in the treatment of many intractable diseases with or without known causes. If it becomes widely accepted, it will probably cause a revolution in the medical world. It could help patients and those who provide medical services reduce their escalating medical costs and avoid the discomforts and side effects of high-technology diagnostic and treatment procedures, which would be used selectively when the non-invasive O-ring test indicates them to be necessary. We can look forward to the bidigital O-ring test's wider use, based on the results of scientific research at many hospitals and to its being taught in medical schools around the world.